Hello, my name is Carllie Wingen, and I am a certified child life specialist at Children's Minnesota Hospital. A little information about child life is we provide therapeutic interventions that are designed to reduce the negative impact of stressful or even traumatic life events and situations that could affect the development, health, and well-being of infants, children, adolescents, and families. We meet families where they are at and provide age-appropriate coping skills to help them process the stressful or traumatic event. The emergency department is a very fast-paced environment that can cause patient and families a lot of stress even when all they are doing is sitting in the waiting room. So let's move on to discuss ways and tips for you to take with you when working with pediatric patients. When working with the pediatric population, you need to be able to build rapport quickly. The way you are approaching a child and talking with them is the first step in getting a child to trust you, to care for them. When working with children, we need to be conscious of our nonverbal cues. Getting down on their level so we're at eye level with a child, make you less threatening and more approachable. Being aware of if you are tense or relaxed is also important, since the children have a keen sense of if someone is comfortable with them or not. Using appropriate eye contact is also important. Too much or too little could impact if the child feels safe around you. Finally, facial expressions are really important when working with pediatric patients. Even though we are still wearing masks, smiling under our masks will help make our eyes and facial expressions more welcoming to the child, as well as how our tone of voice will change. When a child comes to the emergency department, they might feel overwhelmed or stressed by being in a room that does not have a lot of color or any toys to engage with. Starting your conversation with the patient that engages them will help them feel safe and a part of the conversation. Using a calm voice and being mindful of our tone is going to help as well. Talking fast can make it hard for the patient to understand what's happening. It can increase their stress response. Lower and slower speech can help them feel more at ease. Using humor and laughing with a child is also helpful in making the child feel more at ease. You can ask them questions about their grade or what their favorite color is, or just about what they did that day. Anything like that will be very helpful in making the child feel a part of the environment and a part of the conversation. So, ways to respond when a child is in pain. Children coming into the emergency department might be feeling a significant amount of pain, but don't know how to express it. So first, respond promptly to the child's pain in a caring, professional, and practical manner. And direct their attention to the sensations that would be soothing so that they're orienting themselves toward more comforting sensory input. So for example, a child with a laceration you might say to them, "That's a painful cut. We must first cool and clean it up. The coolness of the water will soothe it. Feel the cool and focus on it because that helps your body find comfort." Next, tell the child what is happening to their body in an age-appropriate way. Kids just want to know what's going on. So if a child is in an accident, you could say, "You've had an accident. You're shivering because your body has had a shock and is sore and hurting. It's best not to move at all. Be so still so that you feel your whole body settling. It's good to be still as I carefully check your legs. Lie perfectly still. That's good. I'm going to cover you with a blanket because your body feels cold even though it's hot outside. Feel how that helps? You'll be okay now that you're here. Focus your attention on feeling the warmth growing. You can squeeze mom's hand while we have a look." This repetition of what you need the child to do will help them, and they'll be able to catch on since you've said it a few times and spoken in a comforting tone of voice while providing conscious explanation will be very beneficial to them. Another thing to do is acknowledge the pain. Do not minimize or deny it. Children feel disrespected when their pain is not acknowledged. If a child has a stomach or bowel pain, you'd say something to the sorts of, "These stomach cramps are hurting you a lot. I can see that you're very uncomfortable." Acknowledging their pain will show them that you care and that you're listening and you've noticed that they are in pain. Children feel vulnerable when in pain and do not want to be left alone to struggle on their own. Whenever possible, have a parent or family member remain with a child until the pain is under control. The presence of a known and trusted adult makes the experience bearable for both children and adolescents in a myriad of obvious, subtle ways and enables them to cope. Next, tell the child what positive steps are being taken to deal with the pain. Do not lie to the child, withhold essential information, sugarcoat it, or give false reassurance. Give accurate, age-appropriate information so that the child and parents can make sense of what's happening. And then instruct the child of some pain management strategies, such as deep breathing, blowing bubbles, using imagery, relaxation techniques, or listening attentively to a favorite story or watching a favorite show. And then keep yourself calm, as it will soothe the child's anxiety. Words matter. Our language and the words we use with children matter so much. The language we use to communicate is what they're going to be listening to. When we say IV, a child might think of like ivy on a plant. So using that clearer language is going to be more child friendly, such as a medicine straw to help give your body a drink of water, medicine to make you feel better. Tourniquet, that's another word. Tourniquet's a very unfamiliar word to most kids. So saying rubber band that gives your arm a tight hug is more clear to them. Saying things like the medicine will burn will cause a child to be fearful instead of relating it to other what other children have said. So saying some children say they feel very warm when this medicine goes in will just be a little more comforting to that child. And then using the word sterile is another unfamiliar word. So explaining that you're just trying to keep everything really clean so no germs get in the way. When talking about sedation, you might say something like put you to sleep. And that can be really fearful for children because maybe they had a cat or a dog get put to sleep and they might relate it to that. Like the cat was put to sleep and never came back. So making sure that they understand that we're going to give them some medicine that will help them take a nap and that they won't feel anything until the procedure is over. So just being very clear about the words we're using, because a lot of times the medical terms are just going to go right over what they know. And so just making sure that we're being very clear, but in an age-appropriate way in how we're communicating to these kids. If an adult tells you not to worry and you weren't before, you better hurry up and start because you're already running late. I really liked this quote because a lot of times we say to children, oh, don't worry, it's not going to hurt. And a lot of times they kind of are like, well, why is it going to hurt? Because all they heard was pain or hurt or worry, and then it just kind of gets them a little bit more frantic. So we just need to be really careful and aware of the words that we're using around children, even if we're just talking to the adults in the room, because they're always listening. So a few ways to support during different procedures. So for an IV, we like to say it's a medicine straw. And we like to do a little bit of preparation. A lot of times people don't know that it's just a straw and they think that the needle will still be in their arm even though it retracts and only is there to guide. So starting off with the first step, the nurse will start by using a rubber band to give your arm a tight hug. This helps her see the blue lines, which are known as veins in our body. Then she'll touch to see where the best spot is, explaining that an IV is just a medicine straw to give our body a drink of water and a special medicine that will help make your body feel better. So providing them with appropriate information of the steps, and then not necessarily telling them about the needle unless they are old enough and can conceptualize that part. Because a lot of times if you're using numbing medicine, such as EMLA, they're not going to notice the poke part. Because it works really well, especially with distraction. So then creating that coping plan for the IV, making sure that parents are present, maybe we have a comfort positioning, we've got some distraction, possibly a visual block. Really just depends on the patient's coping style. Some kids like watching and feel more comfort when they can, and others just can't handle it and need to have that distraction. So another typical procedure in the emergency room is laceration. So a lot of times the language we use is string band-aids because sutures is just harder for kids to understand, whereas a band-aid they deal with a lot for their cuts on their knees or their elbows. They get band-aids and they get that helps make their owies better. So we need to fix your cut. We're going to use special cream to help make that area of your skin sleepy so you don't feel anything sharp or painful. We use our string band-aids to make the cut or owie all better. And I typically don't mention the needle unless they ask about how the string gets in their skin. And that means that they're at a point where they can conceptualize it or want to know that next step, because some kids are old enough where they can conceptualize it, but they don't want to know. So they kind of are at that avoidant coping, which is okay too. And then if they do want to know, just making sure that they understand that it's a tiny needle to help guide the string, but that they shouldn't feel any of that because the cream is there to help numb and make that spot really sleepy. So providing them with that preparation, that language that's appropriate, and then creating that coping plan with the care team, the patient, the family. Do they want distraction? Do they want a comfort positioning? Who's going to be present? Who's going to help calm them? A CT or MRI. So for younger kids, I usually tell them it is like a donut machine that has a bed that you lay on, and it takes special pictures of your body. Your job is to stay still, just like when you have to take a family photo so that the picture doesn't get blurry. And sometimes I even make it a little bit of a game, like stop and go. Like I say statue, we practice playing statue in the bed. Having parents present, making sure that the child feels comfortable, knows the steps, knows how long it's going to take. Some kids just want to know, is it going to be one show, 2 shows, and relating it time to what they might know. 2 shows of Blippi or 1 show of Bluey. And so then that will kind of give them an idea. And then a splint. The language I use is soft material or bandage put around whatever body part to hold it still and protect that body part until you get a stronger bandage so that your bone can heal and get better. And a lot of times I just make sure that they understand that it's a soft material that we're using, kind of like a pillow or cotton ball or something like that. Providing them with those preparations, and then creating that coping plan with the parents and the patient to figure out what's going to work best. And then for a nebulizer treatment, just explaining that a mist with medicine in it that goes through a tube or a mask that helps, that covers your nose and mouth to help make breathing easier. So just medicine air to give your body some medicine to breathe in and help you breathe better, get that gunk out. A lot of times I watch shows with kids when they're getting nebulizer treatments and they're struggling to keep the mask on, because that's the hardest part, and allowing them to play with it, having the parent put it up to their mouth. If a younger patient that's like 2 sees the parent isn't afraid or another sibling isn't afraid of the mask, it makes it a lot easier for them. So some things to remember are one voice. So one voice should be heard during procedure. Need parental involvement. Educate patient before the procedure about what is going to happen. Validate child with words. You're doing a great job at keeping your body still. I can see that you're taking those deep breaths, really validating the things that they're doing. Offer the most comfortable, non-threatening position. If they need to sit on a parent's lap and the parent gives them a hug from behind. Individualize your game plan. Make sure that it's individualized to that patient. Some kids want to watch a show while other kids might want to play with a sound book. And then choose appropriate distraction to be used. Some things like CoComelon aren't going to be appropriate for older kids, or not using distraction at all for an older kid because they can handle it. Some kids that are older need that distraction to help get them through. Eliminate unnecessary people not actively involved with the procedure. Having too many people can be really stressful for kids, so just trying to limit the number in the room would be helpful. Comfort positionings, back to chest, chest to chest, legs to the side, on the bed, just making sure that they have different options for the comfort positioning. And then pain management, pharmacological, LMX, EMLA, LET, different pain medicines can be used. And then non-pharmacological, Buzzy Bee for any poke, Sweeties for babies, and positive sensory stimulation such as sound or positive touch can be really helpful for kids. And then finally, just to wrap up, children and teens should be allowed to know what is happening just like adults get to know. We can provide an environment that is safe and welcoming, where children don't have to be afraid of going to the doctor to get help. Be mindful of your interactions to help pediatric patients cope with the experience. So thank you for listening and taking the time to see this presentation. Great. I hope that it was helpful, and if you have any other questions, feel free to reach out.